Basiliximab, a monoclonal antibody used in transplant immunosuppression. Question 1. Mechanism and use. A 52-year-old man undergoing renal transplantation receives Basiliximab as part of his immunosuppressive regimen. What is the mechanism of action of this drug? A. Inhibits IL-2 transcription by blocking calcineurin. B. Blocks mTOR pathway to inhibit IL-2 response. C. Blocks IL-2 receptor on activated T cells. D. Inhibits purine synthesis in B and T cells. E. Suppresses TNF-α by inhibiting NF-κB. C. Blocks IL-2 receptor on activated T cells. Explanation. Basiliximab is a monoclonal antibody that blocks the IL-2 receptor, CD25, on activated T lymphocytes, thereby preventing T cell proliferation and reducing the risk of acute rejection, especially in kidney transplants. Why not the others? A. Describes calcineurin inhibitors, e.g. tacrolimus, cyclosporin. B. Describes sirolimus, mTOR inhibitor. D. Describes mycophenolate mofetil. E. Describes corticosteroids. Question 2. Adverse effects. A 48-year-old woman receives Basiliximab as part of immunosuppressive therapy after renal transplantation. She reports leg swelling, hand tremors, and elevated blood pressure at her 1-month follow-up. Which of the following best explains these findings? A. Cyclosporine-induced nephrotoxicity. B. Acute transplant rejection. C. Expected side effects of Basiliximab. D. Drug-induced diabetes mellitus. E. Antibody-mediated thrombocytopenia. Correct answer, C. Expected side effects of Basiliximab. Explanation, common side effects of Basiliximab include edema, hypertension, and tremor. These are not due to direct nephrotoxicity, but are well-documented adverse effects of the drug. Why not the others? A. Cyclosporine can cause similar symptoms, but is not mentioned here. B. No signs of graft failure or rising creatinine are provided. D. Basiliximab is not associated with diabetes. E. Thrombocytopenia is not a major side effect of Basiliximab. Would you like